Hi there, my name is Vic Veer. I'm an ENT consultant from the Royal National ENT Hospital in central London. My job in the NHS is to provide surgical help for people with snoring and sleep apnea. So this video is all about oropharyngeal exercises for snoring and sleep apnea. I've made this video primarily for my NHS patients so they could understand better of the exercises I wanted them to do at home. Now, it's quite difficult to provide these exercises in a letter format, which is why I've done this video. So firstly, a little bit of background. Snoring, I'm sure lots of people know, it's these noise that a lot of people know and understand. I'm not going to explain that any further. Sleep apnea is slightly different. This is when instead of the tissues flapping around at night and making that noise, they block your airway so much that they stop you breathing. They collapse in and stop you from breathing. This is often quite hard to see when you watch people sleep. Occasionally you might see a pause in their snoring. They snore and they pause for a short time and then start snoring again. When it gets more severe, you'll see that they snore and you can see them actually having difficulty in breathing, and then they'll let out a huge breath and start snoring again. So that is sleep apnea. It's a complete cessation of breathing during sleep because of collapsed airways at the top here. The symptoms of sleep apnea include feeling quite tired during the day and often waking up unrefreshed after a full night's rest. Also, these people have problems with weight gain. They also wake up with morning headaches. They have a headache first thing in the morning and wonder why they've had a full night's rest. And also at night they tend to wake up to go to the toilet, which they think is because they've just got a full bladder, but actually it's sleep apnea causing them to have a full bladder. Untreated sleep apnea leads to high blood pressure, infertility, diabetes, and goes on to causing heart attacks, strokes, etc. So it's a big problem, particularly in this country and other developed countries. Now, there are a lot of very good treatments for sleep apnea and snoring, such as the CPAP mask or a mandibular advancement device. Mandibular advancement devices are like a splint or a gum shield that you wear in your mouth that brings your lower jaw forward, opening up your airway. Also surgery, which is my specialty on the NHS, but there are these things called oropharyngeal exercises, and these exercises are meant to help you get better. These exercises tighten up your throat and stop them from collapsing in and causing sleep apnea and snoring. If things are tight at the back of the throat, there's less chance of the noise and the collapse that can occur. The evidence for oropharyngeal exercises is increasing and growing every day. Camacho wrote a paper where he looked at all the different studies out there and found that on average myofunctional therapy improved snoring and sleep apnea by approximately 50%. Now that's great, but myofunctional therapy is not quite oropharyngeal exercises. Myofunctional therapy also looks at balance, posture, and a number of other things to do with the upper aerodigestive tract. Oropharyngeal exercises is all I'm going to describe today, and the reason for that is that you can't get myofunctional therapists on the NHS yet, and I can only really provide you with information about the exercises. So at the moment, if you wanted the full myofunctional therapy treatment regime, you'd need to go privately to see one of these therapists. But for my NHS patients, all I can provide are these oropharyngeal exercises, and I'll explain each of these exercises to you. What I've done is I've looked at all the studies and papers on myofunctional therapy and the exercises they use in those studies, and I've tried to amalgamate them all, and I've provided a list of exercises I'd like my patients to do on the NHS, things that I think are achievable without a myofunctional therapist. Now, be aware that it's not the same as myofunctional therapy, but it's as close as we can get because I just have no access to a myofunctional therapist on the NHS. So what I've done is I've broken up the exercises into 5 separate parts. What I've done is given you the most basic version, but I'll tell you different ways to make it harder for yourself so you can exercise it even more. So if you find that these initial exercises with time become too easy for you, you can make it harder for yourself and therefore hopefully strengthen up your throat a bit more. So the first exercise is probably the easiest. All you need to do is stick out your tongue as far as it can go. So as far as it can go, either touch your chin or touch your nose, and you're meant to hold it out there for about 5 seconds. Now, I'd like you to do this at least 3 times. You can go up to 10 times if you can manage it, but I don't want you to hurt yourself. Just pull your tongue out as far as you can go, hold it for 5 seconds, go back, relax, then do it again. at least 3 times at the start. I wouldn't go too far to 10 because there are lots of other exercises for you to do. Now, some of you may have a little tongue tie. I've got a tongue tie. If that's the case, there are things you can do to still do this exercise. For example, you can curl your tongue up like that and still then push your tongue out. Or you can curl it down if you find that easier against your lower teeth and then still push your tongue out. That way you're not hurting your tongue tie at all. And another way to do it is to get a spoon and you can stick your tongue out and push against the spoons like that. And you should feel it down here when you do that pressure. You should feel it down the middle of your tongue. So now that we've done the first exercise, we're going to the second one, which is you've gone out. Now you're going to push your tongue up. So what I want you to do is use the full surface area, the top half of your tongue, and suck it right to the roof of your mouth, as much of the surface of your tongue to the roof of your mouth. So like this. And suck it there for at least 5 seconds, hold it there, and then relax. Again, I only want you to try 3 times to begin with, but if you become better at this, you can go on to 10 times, and it should give you more exercise if you do it that way. Now, if you find even that too easy, what you can do is when you're sucking your tongue to the roof of your mouth, like this, you can try opening your mouth at the same time. So you go, and you'll find it stretching a little bit more. So you might have to start off with your mouth closed, but as you get stronger, you'll notice that you'll be able to open your mouth. If you look in the mirror, you'll see that the tongue gets pushed right up rather than sort of sitting in your mouth when you look in the mirror. So that, as you get better, you'll notice that everything starts coming up as you can work those muscles a bit stronger. And the idea is to try and pull your tongue up and feel it stretching in the back of your throat. If you can do it almost 10 times and you can open your mouth wide and still suck the tongue onto the roof of your mouth, you can also look up at the same time. That sort of stretches it as well. So all of these things can make your exercise a little bit harder and therefore give you something more to aim for. So I'll go on to the next exercise now. We've gone forward, we've gone up. Now we're going to go left and right. Now one way is to stick your tongue right across like this into the cheek here. Now that tends to just stretch the tongue, and sometimes you're not able to do it because you have a tongue tie, or your tongue, the delicate under the surface of your tongue touches some sharp teeth on the side here. So another way to do this is to push your tongue into your cheek, but push against it with your fingers here, like this. So you're pushing your tongue that way. And when you do that, you'll notice that when you do that on this side, you'll feel that your tongue is being exercised on this side. And then I'd like you to do on the other side, push against your fingers on this side, and you'll feel it on that side. So to start off with, all I want you to do is twice on one side, twice on the other side. If you can go to 5 on each side or even more, that's great. What I'm trying to do is not make these exercises too onerous when you start off. I want you to be able to do these every day so it doesn't become a thing that you have to do. They're quite easy to do, shouldn't take too much time, and hopefully they'll also help your snoring and sleep apnea. Now, exercise number 4 is slightly different. We've gone forward, we've gone up when we're sucking the tongue to the roof of the mouth, we've gone left and right. Now, this time you're bringing your tongue down. Now, that's quite difficult to do normally. It's worth sometimes starting off in a mirror and watching your tongue go down the back of your throat. So you open your mouth and let it drop down your throat and hold it there again, 5 seconds, about 3 times. If you can do more, that's great. So what you're doing is looking in the mirror, going like this, and dropping it down. It's quite hard to do without raising your eyebrows at the same time, but it's like, and it almost feels like you're gagging or choking on your own tongue. You could try putting your fingers on your tongue so you can watch it go down, maybe even push it down to sort of feel what you're trying to get. If you look in the mirror and you can see the back of your tongue, the uvula, the little dangly thing at the back of the tongue, some people call it the punching bag. If you notice that the uvula goes up when you do this exercise, you're on the right track. What we want to do is try and strengthen up those back muscles so you don't snore or have sleep apnea so much. Another way to encourage your tongue to drop down and hold it there would be to say the word ah. Just like a doctor sees you with a tongue depressor, puts your tongue down, makes you say ah. Your tongue does tend to fall down when you do that. And again, your uvula, the punching bag, the dangly thing does go up when you do that. So if you go ah, you're trying to bring your tongue down and hold it there for 5 seconds, release, do that at least 3 times. Again, you're trying to exercise your throat as much as possible. If you can and you want to progress a little bit more, and you've done 10, say, of this exercise, you could try some of the other vowel sounds as well, like E, oo, all those sorts of... and when you do that, I want to really exaggerate the tension in your neck when you do it. So E, like this. And not so much the facial muscles, but what I want you to do is exercise the inside of your throat. So make it really feel like you're exercising the inside of your throat when you make these noises. I mean, you don't actually have to make the noise. We're not trying to exercise the voice box. What I want you to do is try and exercise the throat muscles. You should feel it exercising there. And now we're on to the 5th exercise, the last exercise. Quick recap, we've gone forward, we've sucked the tongue up, left and right, we've brought the tongue down. And this time what I'd want you to do is push your tongue up against the front teeth. So close your mouth and bring your tongue up against the front teeth. And hold it there and swallow. So you're... whilst holding your tongue forward. Now you might find it easier when you're pushing your head down and swallowing then. Sometimes you need water to do this. As you get better, you might find that you're able to look up and swallow at the same time. You'll find it really hard at the start trying to swallow like that. And again, we're just trying to get those muscles working. So those are the 5 exercises. Quick recap, you're sticking your tongue out, holding there for as long as you can, should I say 5 seconds, and then dropping it back in. I want you to do that 3 times as a minimum. You can go up to 10 times. If you find that sticking your tongue out hurts the underneath of your tongue or hurts the tongue tie, you can curl it up like that or curl it down and then still push out your tongue, so you're not damaging the delicate undersurface of your tongue. You can also use the spoon and push against the spoon, so you're actually causing some sort of pressure against there. So that's forward, that's the first exercise. You're sucking your tongue up to the roof of your mouth. Is the second exercise, holding there for as long as possible. Opening your mouth to make it harder, looking up to make it even harder. The third exercise is left and right, pushing against, doing it 5 seconds, holding it there. 1, 2, 3, 4, 5. That's not actually seconds, a little bit slower than that. But at least twice on each side. If you can go to 5 times on each side, that's great. Then I want you to do is to bring your tongue down to the back of your throat as low as you can, not so far as it makes you gag, but again, you're trying to hold it there for 5 seconds. Sometimes it helps to go ah and holding it there. Really feel the tension and also see the uvula rise up when you do that noise. And so the last exercise is that you're pushing your tongue against the front teeth, closed like this, and you're trying to swallow at the same time. And you just try and get those muscles working. If you find that too easy, or if you find it too hard, you look down and you'll find it easier. If you find it too easy, look up and you'll find it even harder. The more you look up, the harder that exercise will get. What I'd like you to do is try and do these exercises at least once a day, and possibly just before you go to bed, or in the time of coronavirus, we've all got masks. You can probably do these on public transport and no one will know you're doing them, apart from the R, I guess, and using the spoon. But try and do them at least once a day, and just monitor how well your sleep apnea snoring gets on. If you feel more refreshed in the morning, if your snoring seems to be going down, that's a great sign. You keep going, keep exercising. Hopefully we can tighten up your throat muscles and get you good results without the need for masks, mandibular advancement devices, or even the last resort, which is surgery. Thank you very much for watching this video. I hope you found it useful. Please do like this video and subscribe to my channel. It really helps me with my YouTube content.